Hello friends! Welcome to my video. My name is Ziti and I am a summer school student of Keynes. I'm attending the drug discovery course tutored by Dr. Jacob and I'm asked to make a video to introduce palovarotene to you. It is the latest drug for Fibrodysplasia Ossificans Progressiva, the so-called FOP. So what is FOP? Simply put, it's an ultra-rare disease that slowly turns your body's normal muscles into bones, eventually trapping your movement. In November 17, 1933, Henry Raymond Eastlake was born at Women's Hospital of Philadelphia. Until the age of 4, his life was as carefree as any other child's, except for his congenital bilateral hallux valgus. Eastlake first experienced a triggered proliferation due to an injury. He was about 4 years old, playing with his sister, outdoors. A car hit his leg, injuring his left femur. He was taken to the hospital where his leg was put in a cast before returning home. Oddly enough, the fracture never set properly, and when the cast was removed months later, his leg was painfully swollen with a high amount of inflammation. Doctors found his bony deposits by X-ray, but did not make a correct diagnosis. The 11 surgeries that followed instead worsened his condition. This is the world's most famous case of FOP. After Eastlake's death, his body was donated to scientific research, and his skeleton is now on display at a museum in Philadelphia. FOP is a genetic disease. That means that children are born with the condition. However, the slow progressive nature of the second skeleton development means it is not always diagnosed quickly. A common symptom observed at birth is a curved big toe. FOP is a particularly painful and debilitating condition. Therefore, it is important to develop drugs that treat FOP. In FOP, the extra skeleton bone is derived from stem cells that are recruited as the affected tissue by injury and inflammation. In the past, there were no approved treatments for FOP. However, researchers attempted to develop a potential FOP treatment based on insights into cellular mechanisms that control cartilage and bone development in particular. Treatments with the ability to inhibit signaling in the bone morphogenic protein pathway or BMP pathway. Individuals with FOP have a mutation in the ACVR1 gene that encodes for the ALK2 receptor, a BMP type 1 receptor. The mutation allows the receptor to become more active, especially when bound by extracellular protein called ligands, thereby resulting in excessive BMP signaling. Intracellular protein messengers, called SMADs, are activated by the addition of a phosphate group and then form complex that deliver the excessive BMP signaling to the cell's nucleus. The activated SMADs regulate gene expression so that the recruited stem cells are misdirected to differentiate into cartilage. The cartilage is then replaced by heterotopic bone. Because FOP is not amenable to invasive treatment, the development of pharmacological treatments has become a top priority. In 2011, palovarotene, a drug formerly used to treat lung disease, was accidentally found to be successful in preventing bone formation in mice with FOP. Palovarotene is a retinoic acid receptor gamma agonist. In 2011, animal studies demonstrated that RARγ agonists, including palovarotene, blocked new bone formation in a genetically modified biological mouse model of FOP, containing a continuously active ACVR1 ALK2 receptor in a dose-dependent manner. In 2016, study demonstrated that palovarotene also inhibits spontaneous heterotopic ossification, maintained limb mobility and functioning, and restored skeleton growth in FOP mouse models. So why is palovarotene special? In 2023, the FDA approves palovarotene for marketing. It is the first FOP therapy approved for marketing in the world. The original role of BMP was to involve in fetal bone formation. After normal bone formation, BMP is inactivated by the body. When a small wound occurs in the normal body, the body calls on immune cells to mount an inflammatory response to remove the necrotic tissue and generate new fibers and blood vessels to fill in the lost area. However, overactivation of BMP causes endothelial cells to transform into mesenchymal stem cells. which can differentiate into osteoblasts, which in turn form bone tissue. Under the continued action of BMP, this new bone tissue fuses with the normal bone, completely pinning the patient down and rendering him or her immobile. Mechanistically, the drug can reduce new abnormal bone formation by acting on the BMP type 1 receptor ACVR1-OCT2 and inhibiting the abnormal activation of its downstream pathway. The FDA's approval was based on efficacy and safety data from the Phase 3 trial, the first and largest multi-center open-label trial in adult and children patients. 107 study subjects with FOP received a protocol of taking oral palovarotene. The results of the study demonstrated that palovarotene was effective in reducing the volume of analyzed heterotopic ossification in patients compared to untreated individuals in the FOP natural history study. The study also confirmed that palovarotene has a significant safety profile with adverse events consistent with the systemic retinoid category. The most common treatment-emergent events reported in the study were dermatomucosal events such as dry skin and musculoskeletal events such as premature growth plate closure in growing children. Marketing approval of palovarotene has not been smooth. Until August 2023, palovarotene has only been approved for use in patients with FOP in the US and Canada. It is estimated that around 900 patients worldwide are still suffering from FOP. The average annual pricing for Soho-Nose palovarotene is $624,000, and the actual cost may fluctuate as the drug needs to be dosed during episodes. Stakeholders reviewed. That's all I want you to know about palovarotene. Thank you for watching my video.